Welcome back. It's been a little more than a year since the launch of the Suicide and Crisis Lifeline's 988 hotline. The U.S. government changed the lifeline from a 10-digit number to a simple 3-digit one in an effort to make it easier for people to remember and use. And Karen Borda tells us, according to a new report, it appears to be working.
Analysis by the nonprofit KFF found that the new number received 4 million calls from July of 2022 through May of this year, up 33% from the year before when the lifeline was still an 800 number. But not all of those calls are being answered. Nationally, the answer rate for calls, texts, and chats is 93%, according to the same analysis. But here in Texas, about 1 in 4 calls went unanswered. Outside of the 988 line, more Americans are reporting poor mental health and seeking help. Gallup polling shows that in 2022, 75% of Americans described their mental health as excellent or good, down from 85% in 2019. Dr. Rashida Sharma, a licensed professional counselor supervisor who serves as a department chair at UNT, told us part of what we're seeing is still from the impact of the pandemic. She also said more professionals are reporting a high level of burnout, and there's also greater mental health awareness due to social media.
There are a lot more licensed therapists or psychologists who are using social media in a productive way by increasing individuals' awareness of various topics.
23% of adults said they visited some sort of mental health professional in 2022. The last time Gallup asked that question on a poll was in 2004, and at that time, 13% of adults said they'd sought help for mental health. Overall, younger Americans were more likely to say their mental health wasn't great. 46% of 18 to 24-year-olds said their mental health was fair or poor, compared to 18% of those in the 35 to 54 bracket and 16% of those 55 and older. If you're in a position where you're wondering whether it's time to reach out for help, Dr. Sharma says a key indicator that you should is if you're having more off days than on days. But it doesn't have to be that extreme. Even things like job dissatisfaction and wanting to make a life change can be reasons to visit a mental health professional.
Sometimes I feel that there is a misnomer that you have to really be struggling in order to accept help or in order to reach out. Part of this is also preventative care.
A barrier many people face when trying to reach out for help is a lack of mental health professionals. 248 of our state's 254 counties have been designated by the federal government as having mental health professional shortages. Dr. Sharma says patients often have to wait months to be seen. If you are either struggling to find a provider or if you don't feel like you need professional help right now, she does have some tips to help manage stress. 1, have a support network. 2, practice mindfulness. Try to accept things the way they are without labeling them as good or bad. 3, take on hobbies. And 4, practice gratitude.
It may not sound like a lot, but sometimes just taking stock of the things that are going well in your life goes a very long way in helping us keep things in perspective.
If you or someone you know is in mental distress, the 988 hotline is available 24 hours a day. Karen Borda, CBS News, Texas.